I'm Steve with Fitness for 5 and Fitness for 10. I'm with Dr. Nario. As you know, if you've been watching our series, Dr. Nario is with Biointegrative Health Center in Reno, Nevada. It's a clinic I go to. People come from all over the country, even some from other countries. So you can look them up online, Biointegrative Health Center. Welcome, Doctor.
Thanks, Steve, for the invite.
Okay, so let's talk about melatonin today. So what's melatonin? Why is it important? How's it work?
Steve, that's a pretty good question that almost every patient of mine asks. And the thing here is, questions that comes along with this hormone is, do you have daytime sleepiness? Do you have poor concentration, irritability, inability to fall asleep, or even staying asleep during the night? So they always kind of call this or correlate this with insomnia. And of course, if insomnia is chronic and if it's persistent, definitely a word or a supplement that you will always hear would be the use of melatonin. So it's a hormone in the brain that's created by the organ called the pineal gland. It's almost like a little pea or an olive-sized type of organ in your brain, and it only is produced in relation to exposure to darkness. And the brain also is getting transitioned or assisted by melatonin from waking up to sleeping. It also helps with what we call the circadian rhythm, or the 24-hour internal clocks that we have. And the thing here is, being exposed to light at night can prevent melatonin production. This includes night lights, including our phones at night when we play around with it, playing those games, looking at social media, and even watching TV. So these little habits that we have before going to bed, sometimes we don't realize it's detrimental for our melatonin production. And the key here is increasing the levels is related to having more darkness. That's why turn off everything, and lowering the levels is related to more light exposure. And the body likely produces enough melatonin really for our general needs, but the production as we get older declines.
Okay, so I take it there's some health benefits of melatonin. So are there benefits of actually taking some type of a melatonin supplement, or are there benefits to that?
Yes, Steve, supplements are out there. The thing here in general, as I mentioned a while ago, it is mostly known for the treatment of insomnia or assistance of inducing sleep. And the thing here is, you have this term called delayed sleep-wake phase disorder. And that's more of a medical term for insomnia, but it is basically defined as trouble falling asleep at usual times and waking up in the morning. And to be more specific, difficulty getting to sleep before 2 a.m. to 6 p.m. If you're still up, that's already a problem. And sometimes you would prefer to wake up between 10 a.m. to 1 p.m. These are abnormal sleep cycles if they prefer waking up during those times. Another use for melatonin is jet lag. And when you travel across multiple time zones, not only am I talking about international travel, but I'm also talking about east to west, any hour difference, that's already considered a change in your circadian rhythm. And this jet lag effect always leads to like not feeling well, disturbed sleep, daytime tiredness, impaired functioning, and sometimes even digestive problems. Another use that melatonin is not known for is anxiety, specifically sometimes used before and even after surgery. And 80% of patients who use this during this time actually has a good relief or lowering down of their anxieties. And another one that I always use it for, because I work in the cancer center, it's the anti-cancer effects of melatonin, and also being a powerful antioxidant. We use this a lot in patients who has breast cancers, and it affects the cancer's metabolic growth and activity. But we're talking about higher doses of melatonin here, even up to the point of 75 milligrams to 100 milligrams. Really depends on the condition.
So are you saying that if there could be negative effects, like if by taking melatonin? Are there common side effects?
Yes, Steve. The melatonin word sometimes is getting overused, meaning that I can take it anytime. It's pretty safe, and it's very popular. But the good thing about melatonin, it's non-habit forming. It has a low risk of what we call sleep inertia, meaning when you wake up, you feel groggy or hungover. That's very low for melatonin. If you take too much, it can happen. But even on studies, 2015 study that was done on it, medical research has shown that there are only mild side effects such as headaches, dizziness, nausea, and sleepiness, and most of the time affiliated with dosing. So we start usually, so this is where your pen and paper comes out, we start at 3 milligrams, and then we progress ourselves to the point of even going up to 10 milligrams the most. Because if you go higher than that, that's when you feel the side effects that I just mentioned a while ago. But it's different for cancer patients. Now we're talking about 75 milligrams, 100 milligrams a day. But again, I wouldn't suggest regular people taking that. You need medical supervision for that. Rule is start low, go slow. And everybody's dose is different. That's why it's individualized, and you have to find your own dosing to understand the maximum effect of melatonin. And also, we have to understand we have our own creation. So we're adding supplements to our own creation. That's why there is what we call the individualized dosing for everybody. And always a reminder, light destroys melatonin. So when you take it, you have to make sure everything is dark. There's also a key here that unless you can shut your eyes tight as a clamp, but I would suggest turn off all night lights, put on an eye patch the one when you're in the airplane, no phones, because blue light from a phone overstimulates the brain and breaks up melatonin, and no TV before going to bed. From all the darkness that I've been talking about in terms of preparation involving the melatonin use, side effects to watch out for mostly is tripping over something or bumping into walls.
So how's this administered? Are you saying you take it in a capsule form or what?
There are different ways on how to take it. So basically the medication or the supplement is made synthetically, and always a suggestion, take 30 minutes before going to bed. The thing here is the most popular one would be the pills, the capsules, and the tablets. The pros when you use this, it has longer shelf life, tasteless, easy to divide. You can cut it in half, 1/4, and even taking it less in terms of the recommended dosing. And the cons for the pills, it can be difficult to swallow. You need to take more water before going to bed, thus causing you to pee at night. Another form is liquid, and this includes sublingual drops under your tongue. The pros of this, it's easier to take if you have difficulty swallowing pills. It's faster absorbing, especially under the tongue. And the cons would be unpleasant taste and might be even more expensive than the pill form. The melatonin gummies is something that I've been seeing a lot lately, and we use this a lot with people. I mean, on the younger age group, but I wouldn't suggest melatonin melatonin for the younger ones, because it's just mostly there are modifiable reasons why they cannot sleep. Though it tastes good and it's chewable and easier to swallow, but the negative part of that is you may take them more than what you're supposed to because they taste so good and you treat them like candy. In our clinic, actually is the one that we prefer doing is IV melatonin. And the pros of that would be fast acting. It can deliver high doses, especially for cancer patients or chronic conditions. And the cons, of course, is because you need to use a needle for that. It's invasive. But it does not only help for chronic conditions, but also for healthier individuals because of the antioxidant effects of melatonin. Melatonin, we still administer that. May you be having an illness or you may be healthy.
Okay, so do we need to be aware of or concerned about maybe any possible interactions with other medications that someone might be taking?
Well, Steve, yes, the supplement is very safe, but you have to make sure that these interactions would be remembered by the taker. meaning people who takes aspirin or blood thinners. If it interacts with melatonin, it can actually increase the risk of bleeding. People who have diabetes, high blood pressure, very rare. It can actually affect sugar levels. It can affect the blood pressure. That's why I just take it farther apart. Another one would be drug altering in terms of the consciousness of the patient, meaning most of the time pain medications, the opiates, or even anti-anxiety medications such as Xanax can add to the sedating effect if you take them both together. And also something that I just knew about, contraception. Melatonin might actually produce sedation when mixed with contraception. Again, very rare. Another suggestion, a best suggestion for this is take them farther apart.
Okay, well, you answered how we can take it and all side effects. So very interesting. Thank you, Dr. Nario, for that. Dr. Nario, Biointegrative Health Center, Reno, Nevada. Thank you, doctor.
Thank you, Steve. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.